Most frequent question in the OPD when a patient comes to me is, Doctor, can you please have a look at this HSG or an X-ray of my tubes? I am in the process of fertility treatment, and when I have undergone this investigation, they have told me that there is a blockage in one of my tubes, and also there is a fluid in one of my tubes, and that I will not be able to conceive naturally. So, is it true, and what am I supposed to do? This condition, where a fluid is filled in the tube or the fallopian tube, is called as hydrosalpinx, and it is one of the most distressing diagnosis because there are no symptoms. Most of them will not even know unless they have undergone a X-ray to know whether the tubes are patent or not in the process of infertility evaluation. It comes to us as a surprise to many of the couples because they would have imagined that they would have had this problem. So the reasons why this problem happens is because of any infection in the tubes, any inflammation in the surroundings, or sometimes there could be a tuberculosis. So what do we do when we have a hydrosalpinx? It is mandatory to treat the hydrosalpinx because even bypassing the tubes and doing something in IVF is a possibility. We will not be able to do even an IVF treatment if a hydrosalpinx is present because the fluid which is present in the tubes is embryotoxic and will destroy the embryo even if you have placed the embryo in the process of IVF without treating the hydrosalpinx. So it is mandatory for treating the hydrosalpinx before anybody gets pregnant. So how do we treat it is the most gold standard is doing a laparoscopy and delinking the tube. So it is always better to delink the tube and ensure that there is no toxic fluid which crosses and comes into the uterus so that the uterine environment is safe for conception. For more such videos, please follow this space. Thank you.